Hi there. Welcome to my YouTube channel, My Health and Me by Fun. Please like, subscribe and share. Today, I want to talk about anxiety. In our fast-paced society, anxiety has become more prevalent than ever. Anxiety is that persistent feeling of worry, nervousness, or unease about something with an uncertain outcome. Symptoms vary depending on the type. There are psychological symptoms such as the feeling of panic, fear, uneasiness, and irritability, uncontrollable, obsessive thoughts and difficulty concentrating. Physical symptoms may include restlessness, heart palpitations, shortness of breath, muscle tension, cold or sweaty hands, numbness or tingling in your hands or feet, difficulty falling asleep or staying asleep, known as insomnia. Anxiety disorders come in various forms. Pause 3s. Generalized anxiety disorder, GAD, is excessive, frequent, and unrealistic worry about everyday things. Agoraphobia causes an intense fear of becoming overwhelmed or unable to escape or get help. People with agoraphobia often avoid new places and unfamiliar situations, like large open areas or enclosed spaces, crowds, and places outside of their homes. Panic disorder is when multiple unexpected panic attacks occur. Attacks usually happen without warning and aren't due to another mental health or physical condition. Social anxiety disorder, also known as social phobia, happens when one experiences intense and ongoing fear of being judged negatively and/or watched by others. Separation anxiety disorder happens when you feel excessive anxiety when you're separated from a loved one, like a primary caregiver, while separation anxiety in babies and toddlers is a normal stage of development. Separation anxiety disorder can affect children and adults. Selective mutism happens when you don't talk in certain situations because of fear or anxiety. It usually affects young children, but it can also affect adolescents and adults. There are other specific phobias, like when something causes you to feel fear or anxiety that's so severe it consistently and overwhelmingly disrupts your life. Pause 3s. Now, what causes anxiety? You can identify triggers on your own or with a therapist. Sometimes they can be obvious and other times less so. Common anxiety triggers include work, relationships and other life stresses, withdrawal from drugs or certain medications, side effects of certain medications, exacerbation of past trauma, PTSD, chronic pain, excessive caffeine, or smoking. Everyone has different triggers, and identifying them is one of the most important steps to coping with and managing anxiety attacks. Genetics can also play a significant role, but environmental factors and stress are also key contributors. Our digital age, with social media and constant connectivity, can amplify these feelings, making it harder to escape the anxiety loop. Coping with anxiety requires a multifaceted approach. Mindfulness techniques like deep breathing exercises and meditation can help ground you. Question your thought pattern, as unhelpful thoughts can take root in your mind and distort the severity of the situation. One way is to challenge your fears, ask if they're true, and see where you can regain control. Practice focused, deep breathing. Measured breathing practices may help you manage immediate feelings of anxiety. Try breathing in for 4 counts and breathing out for 4 counts for 5 minutes total. By evening out your breath, you'll slow your heart rate, which should help calm you down. Regular physical activity is another powerful tool. It releases endorphins that naturally combat anxiety. Sometimes the best way to stop anxious thoughts is to leave a situation and get moving. Focusing on your body and not your mind may help relieve your anxiety. Low impact exercises like walking, yoga, and Tai Chi can often help people to reduce stress and manage anxiety symptoms. Therapy, whether it's cognitive behavioral therapy or other forms, provides strategies to manage and reduce anxiety. It can be helpful to create a habit of writing down your thoughts and emotions in a journal daily. The process of writing down thoughts itself can be calming for some. Journaling can also have long-term benefits. Studies show that regular, emotion-led journaling can help reduce anxiety, depression, and feelings of distress. Remember, self-care is essential. Set boundaries, take breaks, and allow yourself to rest. Seeking professional help is a vital step if anxiety feels overwhelming. Therapists and counselors can offer personalized guidance and support. Medications can't cure an anxiety disorder, but they can improve the symptoms and help you function better. Some of them include benzodiazepines, beta blockers, or antidepressants. Psychotherapy, also called talk therapy, is a treatment technique that helps you identify and change unhealthy emotions, thoughts, and behaviors by talking with your therapist. Anxiety is common but manageable. Prioritize your mental health. It's just as important as your physical health. Thanks for listening and take care of yourself.